Good day, I'm Angeline Jampo. So today, I'm going to perform sterile field procedure. The purpose of this is to ensure that sterile remains sterile. Verify that procedure requires surgical aseptic technique. Review client's record or discuss with the client or other healthcare team members exactly what procedure will be performed that requires a sterile field. Determine client's presence or risk for infection and ability to cooperate with the procedure. Assess patient's comfort, oxygen requirements, and elimination needs before preparing for procedure. Assess for latex allergies. Instruct patients not to touch the work surface or equipment during procedure. Check sterile package integrity for punctures, tears, discoloration, moisture, or any other signs of contamination. If using commercially packaged supplies or those prepared by agency, check for sterilization indicator, a marker that changes color when exposed to heat or steam. Anticipate number and variety of supplies needed for procedure. Planning. Expected outcomes following completion of the procedure. The sterile field is not contaminated. Patient is not exposed to microorganism. Correct surgical aseptic practice is performed. Complete all other prior tasks, medication, administration, suctioning patient before beginning procedure. Prepare equipment at bedside. Ensures availability before procedure and prevents break in sterile technique. Position patient comfortably for specific procedure to be performed. Explain to patient purpose of the procedure and importance of sterile technique. Equipment. Package containing a sterile drape. Sterile equipment as needed. Wrap is sterile gauze. Wrap sterile bowl. Antiseptic solutions and sterile forceps. Preparation. Ensure that the package is clean and dry. Check the sterilization expiration dates on the package and look for any indication that it has been previously opened. Follow agency practice for disposal of possibly contaminated objects. Performance. Number 1. Prior to performing the procedure, introduce self and verify client identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he/she can cooperate. Number 2. Observe other appropriate infection control procedures as per agency protocol. Apply PPE as needed. Consult agency policy. Number 3. Provide for client privacy. Number 4. Open the package. If the package is inside the plastic cover, remove the cover using a sterile commercial kit or pack containing sterile items. I'm going to perform how to open a wrap package. First, place sterile kit or pack containing sterile items on clean, dry, flat work surface above waist level. Second, place the package in the work area so that the top flap of the wrapper opens away from you. Third, reaching around the package, not over it, pinch the first flap on the outside of the wrapper between the thumb and the index. Touch only the outside part of the wrapper, maintains the sterility of the inside of the wrapper. Pull the flap over lying in flat on the far surface. Inner kit remains sterile. There is a 2.5 cm border around any sterile drip or wrap that is considered. Reaching over the sterile field contaminates it. Keep arm to the side and not over sterile surface. Never reach over a sterile field. Stand away from sterile package and pull flap back, allowing it to fall flat on the table. Fourth, repeat for the side flaps, opening the top one first. Use the right hand for the right flap and the left hand on the left flap. By using both hands, you avoid reaching over the sterile contents. Fifth, pull the fourth flap towards you by grasping the corner that is turned down. Make sure that the flap does not touch any object. If the inner surface touches any unsterile article, it is contaminated. So next, I will going to perform the opening a wrap package while holding it. First, hold the package in one hand with the top flap opening away from you. Second, using the other hand, open the package as described above, pulling the corners of the flap well back. Tack each of the corners into the hand holding the package so that they do not flutter and contaminate sterile objects. The hands are considered contaminated and at no time should they touch the contents of the package. Next, I will going to perform opening a commercially prepared package. So let's assume that this is a commercially prepared package. So first, if the flap on the package has an unsealed corner, hold the container in one hand, pull back on the flap with the other hand. Second, if the package has a partially sealed edge, grasp both sides of the edge, one with each hand, and pull apart gently. Next, I will going to perform and establish a sterile field using a drape. First, open the package containing the drape as prescribed above. Second, with one hand, pluck the corner of the drape that is folded back on the top, touching only one side of the drape. Third, allow drape to unfold, keeping it above waist and work surface and away from body. Careful discard wrapper with other hand. Fourth, with other hand, grasp adjacent corner of drape. Hold drape straight over work surface. Drape can now be placed properly with two hands. Lastly, holding drape position, bottom half over top half of intended work surface. It prevents nurse from reaching over sterile field. Allow top half of drape to be placed over bottom half of work surface. Creates flat sterile work surface for placement of sterile supplies. By placing the lowermost side farther away, you avoid leaning over the sterile field and contaminating it. Apply sterile gloves. You may touch out there 1-inch border of drape without wearing gloves. So next, I'm going to perform the add necessary sterile supplies to a sterile field. To add wrap supplies on the sterile field. First, open each each wrap package as described in the preceding steps or based on the packaging instruction. Second, with one free hand, grasp the corner of the wrapper and hold them against the wrist of the other hand. The sterile wrapper now covers the unsterile hand. Third, place the sterile bound, drape, or other supply on the sterile field by approaching from an angle rather than holding the arm over the field. Fourth, discard the wrapper. So next, I'm going to perform on how to add commercially packaged supplies to the sterile field. First, open each wrap package as described in the preceding steps or based on the packaging instruction. Second, hold the package 15 cm above the field and allow the contents to drop on the field. Third, keep in mind that 2.5 cm around the edge of the sterile field is considered contaminated. At the height of 15 cm, the outside of the package is not likely to touch the contaminated to sterile field. I'm going to perform on how to add solution in a sterile bowl. First, liquid may need to be poured into containers within a sterile field. Second, unwrapped bottles that contain sterile solution are considered sterile on the inside and contaminated on the outside because the bottle may have been handled. Third, bottles used in an operating room may be sterilized on the outside as well as the inside, however, and these are handled with the sterile gloves. Fourth, before pouring any liquid, read the label 3 times to make sure you have correct solution and concentration. Fifth, wipe the outside of the bottle with a damp towel to remove any large particles that could fall into the bowl of film. Sixth, obtain the exact amount of solution if possible. Once the sterile bottle is opened, its sterility cannot be ensured for the future use. Follow agency protocol or policy for use of open sterile solution bottles. 7. Remove the lid or cap from the bottle and invert the lid before placing it on a surface that is not sterile. Inverting the lid maintains the sterility of the inside surface because it is not allowed to touch an unsterile surface. 8. Hold the bottle at a slight angle so that the label is uppermost. Any label that flew down the outside of the bottle during pouring will not damage or obliterate the label. 9. Hold the bottle 10 to 15 cm over the bowl and to the side of the sterile field so that the little of the bowl as possible is over the sterile field. At this height, there is less likelihood of contaminating the sterile field or by reaching an arm over it. 10. Pour the solution gently to avoid splashing the liquid. 11. Tilt the neck of the bottle back to vertically quickly when done pouring so that none of the liquids flow down the outside of the bottle. Such drip can contaminate the sterile field if the outside of the bottle is not sterile. 12. If the person will be used again, replace the lid securely and write on the label the date and time of opening. Replacing the lid immediately maintains the sterility of the inner aspects of the lid and other solution.
Depending on agency policy, a sterile container of solution that is opened may be used only once and is then discarded, such as in the operating room. In another setting, policy may permit recap bottles to be reused within 24 hours. Next, I'm going to perform on how to use sterile forceps to handle supplies. First, forceps are usually used to move a sterile article from one place to another, transferring sterile gauge from each package to a sterile dressing tray. Second, forceps may be disposable or re-sterilized after use. Third, commonly used forceps include hemostats and tissue forceps. Hold sterile forceps above waist or table level. Items held below waist or table level are considered contaminated. Hold sterile forceps within inside, while out of sight forceps may unknown to the user become unsterile. Any forceps that go out of sight should be unsterile. When using forceps to lift sterile supplies, be sure that the forceps do not touch the edge or outside of the wrapper. The edge and outside of the sterile field are considered unsterile. In placing forceps whose handle were in contact with the bare hand, position the handles outside the sterile area. The handles of this forceps harbor microorganisms from the bare hand. Fourth, deposit a sterile item on a sterile field without permitting moist forceps to touch the sterile field when the surface under the absorbent sterile field is unsterile and a barrier drape is not used. Lastly, document that the sterile was used in the performance of the procedure.
So that's all for preparing sterile field. Thank you and God bless.